you today. During this entire physical assessment, I'm going to be looking at your head, neck, face, chest, abdomen, extremities, looking at your skin for color, temperature, turgor, texture, moisture, scars, bruising, lesions, nevi, and edema. So far, everything looks good. I'm going to go ahead and palpate your head and your scalp, checking and looking at your hair distribution, color, and texture, also feeling for any lesions, masses, depressions, infestations, and tenderness, and there is none. I'm going to go ahead and palpate your temporal arteries. Any tenderness?
No.
Okay. Palpate your TMJ. Will you open and close? Side to side? Good. Checking for any tenderness, subluxation, or crepitus, and there is none. I'm going to palpate the lymph nodes, the preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. Lymph nodes are not palpable, and there's no tenderness. I'm going to do cranial nerve 5. If you will bite down. Good. Checking the masseter muscle. And close your eyes and tell me where you feel this on your face.
Nose, forehead, left cheek, chin, right cheek.
Perfect. So cranial nerve 5 is intact. And do cranial nerve 7 if you will smile, frown, puff out your cheeks, poke out your lips, and raise your eyebrows. Cranial nerves 5 and 7 are intact. And move on to the ears. I'm looking at the shape and the position, and they are midline and they look good. I'm going to go ahead and palpate the pinna and the tragus. Any tenderness?
No.
No masses, no tenderness. I'm going to look in the auditory canal, looking for, looking at the tympanic membrane, and it is translucent and pearly gray. There's no discharge or redness. I'm going to go ahead and do cranial nerve 8. If you will cover your ear and repeat after me.
1, 2, 3. ABC.
That was the whisper test. I'm going to do the Weber test, checking for lateralization. Tell me, do you hear this more in one ear or the other, or together?
Together.
Okay. And the Renee test. Tell me when you don't hear this anymore.
No.
Again?
No.
Okay. Do the other side.
No. No.
Great. Air conduction is greater than bone conduction. Cranial nerve 8 is intact. I'm going to move on to the eyes. I'm looking at the eyelashes, eyebrows, and palpebral fissures. Everything looks good. Looking at the sclera, which is white, and the conjunctiva, which is pink and moist. There's no lesions or discharge. I'm going to check cranial nerve 2 if you'll cover your right eye. Read the lowest line you can.
LTFPH.
Okay, other side.
LTFPH.
And with both eyes.
LTFPH.
Great. We're checking gross visual acuity. He is 20 out of 20 for both eyes bilaterally and together. That was central vision. We're going to check peripheral vision. If you'll look at my nose, tell me when you see my finger.
No. No.
Perfect. So his cranial nerve 2 is intact. Moving on to cranial nerve 3, checking the consensual and direct response, pupillary response to light. If you'll look at my nose. Great, and we're doing accommodation and convergence. Look at my light. Look at the wall. Look back at my light. Great, and they accommodate very well. And do cranial nerves 3, 4, and 6, checking the conjugate gaze with the extraocular motions. If you'll watch my light. Perfect. And 3, 4, and 6 are intact as well. Moving on to the nose, making sure it is straight and midline, and it is. If you'll cover one nostril, breathe in and out. Other side. Perfect. Nasals, patency is clear. Palpating the frontal and the maxillary sinuses. Any tenderness?
No.
No tenderness. If you'll close your eyes and cover one nostril. Tell me what you smell.
Cinnamon.
Okay. Other side. Tell me what you smell.
Alcohol.
Perfect. Cranial nerve 1 is intact. Going to move on to the mouth. If you will open up. Lift up your tongue. Move it side to side. Good. Looking at the buccal mucosa, the lips, teeth, gum, tongue, palate, posterior pharynx, salivary ducts, tonsils, and the floor of the mouth underneath the tongue, and everything was good. It's pink and moist. And then going to check cranial nerves 9 and 10. If you'll say ah.
Ah.
Good. The uvula and soft palate rise symmetrically with phonation, and the cranial nerve 12. If you'll stick out your tongue, move it side to side. Good. The tongue is midline with no fasciculations. Okay, we're going to move on to the next. We're going to check the trachea, making sure it is midline, and it is. You'll turn this way for me. Checking the thyroid gland. You'll swallow. Good. Other side. Perfect. The thyroid gland has no nodules, and it is midline as well. I'm going to palpate the carotid artery. They are 2+ bilaterally. And I'm going to listen for any bruits with the bell. There are no bruits. We're going to check the cranial nerve 11 if you're strong against resistance. Good. That is intact as well. And do cervical spine range of motion. So if you'll flex down, extend, hyperextend, lateral flex, and rotation around in a circle. Perfect. Range of motion is intact. All right. If you will turn this way, we're going to do the posterior chest, and we're looking for any signs of respiratory distress, including use of accessory muscles, tripod positioning, cyanosis, tachypnea, nasal flaring, or retractions, and there are none. We're also looking for any obvious deformities, and there are none, and everything looks symmetrical. Okay, we're going to palpate the chest wall expansion. If you'll take a deep breath. Great. And tactile formitis, say 99.
99.
Great. Those are both symmetrical. We're going to go ahead and do percussion in the intercostal spaces. Great. Resonance is heard throughout. And I'm going to go ahead and auscultate side to side, comparing. You take deep breaths. Great. Lung sounds are clear bilaterally. I'm going to go ahead and listen for egophony. So if you'll say E-E-E. Perfect. And bronchophony, say 99.
99.
Great. And then whisper pectriloquy. If you will whisper 1, 2, 3. Perfect. And that is symmetrical as well. I'm going to go ahead and move on to the anterior chest. You can turn this way. Looking for any obvious deformities, and there is none, and making sure everything's symmetrical, and it is. Going to do chest wall expansion, so if you'll take a deep breath. Great. That is expand symmetrically, and tactile formitis, say 99.
99.
Perfect. That is symmetrical as well. I'm going to go ahead and auscultate side to side. Take deep breaths. Perfect. Lung sounds are clear bilaterally. Okay, I'm going to move on to the heart. I'm going to go ahead and auscultate with the diaphragm the heart sounds. The aortic valve, second intercostal space, right sternal border. Pulmonic valve, second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid valve, fourth intercostal space, left sternal border. And the mitral valve, fifth intercostal space, mid-clavicular line. Do it with the bell. Aortic valve, pulmonic valve, Erb's point, tricuspid valve, and the mitral valve. Okay, and there's no murmurs, gallops, or regurgitations. I'm going to feel for the point of maximal impulse, which should be the fifth intercostal space mid-clavicular line. And then I'm going to auscultate the apical pulse. And I will listen for a full minute and note the rate and the rhythm. Okay. I'm going to go ahead and have you lie down. You can put your head down there and feet down there. Okay. I'm going to, when he's at 30 to 45 degree angle, I will be looking for any jugular vein distension or pulsations, and there are none. I'm going to see there's no heaves or lifts. I'm going to feel for a thrill in each auscultation point. Aortic valve, pulmonic valve, Erb's point, tricuspid valve, the mitral valve. There are no thrills. I'm going to go ahead and auscultate again, starting with the diaphragm, aortic valve, pulmonic valve, Erb's point, tricuspid valve, the mitral valve, and again with the bell, aortic valve, pulmonic valve, Erb's point, tricuspid valve, and the mitral valve. There's no murmurs, regurgitations, or gallops. Sorry. I'm going to move on to the abdomen. Looking at the contour, it is flat and symmetrical. And when I'm doing this in the clinic, I will be doing everything underneath the shirt, but for the presentation, I'm doing everything over the shirt. And so then I'm going to go ahead and auscultate for bruits. The aorta, the renal arteries, the iliac arteries, and the femoral arteries. There are no bruits. I'm going to go ahead and auscultate the vowel sounds in all 4 quadrants. Vowel sounds are normoactive. And go ahead and percuss in each quadrant, listening for tympany, dullness, and flatness. And tympany is heard throughout. And I'm going to go ahead and palpate, feeling for masses. Any tenderness?
No.
No tenderness. Okay, I'm going to palpate the liver if you will take a deep breath. And palpate the spleen. Perfect. The spleen is not palpable. And if you'll go ahead and sit up. And face this way. We're going to check for CBA tenderness. Any tenderness?
No.
Perfect. Okay. We're going to move on to cerebellar coordination. If you will put your hands on your thighs and flip them over. Quick. Perfect. And then do serial finger opposition. If you will move your fingers back and forth quickly. Perfect. And then fingers. So put your finger on your nose and touch my finger over and over again quickly. Perfect. Cerebellar coordination is intact. If you'll close your eyes and open your hands, we're going to do stereognosis. Can you tell me what this is?
Coin.
Yes. And tell me what this is?
Pin.
Perfect. And keep your eyes closed. And tell me what shape this is?
Circle.
And what number is this?
6.
Perfect. Stereognosis and graphesthesia are intact. We're going to go ahead and do vibration sensation. Close your eyes. Tell me, do you feel this?
Yes.
Good.
Yes.
Perfect. That's over the proximal ulnar prominence, and he does feel that. We're going to do the medial malleolus as well. Do you feel this?
Yes.
Yeah.
Yes.
Perfect. Vibration sensation is intact. I'm going to go ahead and do the light touch. Tell me where you feel this. Keep your eyes closed.
Right foot. Left leg. Right knee. Left foot.
Perfect. I'm going to go ahead and do the dorsalis pedis pulses. They are 2+ bilaterally, and the posterior tibial pulses. 2+ bilaterally, and cap refill. Less than 3 seconds bilaterally. Okay, we're going to do light touch the upper extremities. So keep your eyes closed. Tell me where you feel this.
Left hand. Right arm. Left shoulder. Right shoulder.
Perfect. We're going to do the radial pulses. 2+ bilaterally and cap refill. Great. Less than 3 seconds bilaterally. I'm going to go ahead and do the deep tendon reflexes. Radial. Brachial. Tricep. Radial. Brachial. And tricep. Great. Patellar. patellar, Achilles, and the Babinski. Sorry. Good. Reflexes are 2+, and the Babinski's negative. I forgot to look in your eye earlier, so I'm going to go ahead and check your internal structures of your eye. Okay. We're just looking, make sure there's no problems and that there are red reflexes. And red reflexes are present bilaterally. Okay. I'm checking the overall warmth, color, and checking for any edema of the upper and lower extremities, and everything looks good. We'll move on to the joints of the hands, the wrists, the elbows, and the shoulders, checking for any redness, swelling, deformities, tenderness, nodules, crepitus, asymmetry, and everything looks good. All right, we're going to do your fingers, range of motion, so if you will flex, extend, hyperextend, adduct together, abduct out, and thumb up position. Great. And you will do a hand grasp if you'll grasp my fingers. Good. Strength is 5 out of 5. And we'll do your wrists, flex, extend, hyperextend, radial deviation, ulnar deviation, and rotation. Perfect. And elbows, flex, extend, hyperextend. Perfect. You'll pull towards you. Good. Push towards me. Great. Strength for biceps and triceps is 5 out of 5. All right, shoulders. You'll flex up, extend, hyperextend back, abduct out, adduct together, external rotation, internal rotation, and circumduct in a circle. Perfect. And then push out against me. Good. And pull in against me. Good. Strength for abduction. Adduction of shoulders is 5 out of 5. And range of motion is intact for the upper extremities. Okay. Move on to the lower extremities. Do your toes. Or I'm going to look at the joints of your feet, your ankles, your knees, and your hips, looking for any redness, symmetry, deformities, crepitus, tenderness, nodules, and make sure it is all symmetrical. I'm looking for any edema. And there is none. Everything looks good. All right, we're going to do your toes. We're going to flex down, extend, hyperextend, adduct together, abduct out. Good. And then we're going to do your ankles. So if you will dorsiflex up, plantar flex down, invert, evert, and rotation. Good. All right, if you will push up against me. Good. And push down against me. Perfect. Plantar and dorsiflexion strength is 5 out of 5. All right, you'll push your knees out against me and pull in. Good. Strength is 5 out of 5 for the knees as well. Okay, you can go ahead and stand up. All right, we're going to do the range of motion for your knees. If you will flex, extend, hyperextend. Good. Other side, flex, extend, hyperextend. Good. And let's do your hips. You will flex up, extend, hyperextend back. Good. Internally rotate, externally rotate, abduct out, abduct together, and circumduct in a circle. Good. Do your other one. Flex, extend, hyperextend, internally rotate, externally rotate, abduct out, abduct across, and circumduct in a circle. Good. Okay. Now we're going to look at your spine. I'm looking at the curvature, the alignment. Is there any tenderness?
No.
Nope. All right. You'll lean forward, looking for any scoliosis, and there is none. We're going to do the range of motion for your spinal column. You'll flex. Good. Extend. Hyperextend back. Lateral flex, side to side, and rotate. And circle. Cool. Good job. And then we're going to do the Romberg test. So if you will close your eyes and stand still. Perfect. All right, we're going to check your gait. So if you'll walk to the wall. Good. And when you come back, do toe to heel. Checking your tandem gait. Perfect. All right, if you'll hop on one foot, hop on the other foot. Perfect. And this concludes our assessment.